November 18th, 2004. Room 216 of the Hart Senate Office Building. A man takes his seat at the witness table and waits to be sworn in. His name is David Graham. He is the Associate Director for Science in the Food and Drug Administration's Office of Drug Safety, and he has worked there his entire 20-year career. Before the morning is out, he is going to tell the United States Senate that his own agency cannot protect the American public.
Is incapable of protecting America against another Vioxx. We are virtually defenseless.
He is not a whistleblower who quit. He did not resign the night before. He came in from the FDA's offices in Rockville that morning, and he went back to them afterward. The drug he came to talk about was pulled 7 weeks ago. An estimated 20 million Americans had taken it. By his own estimate, it caused somewhere between 88 and 139,000 heart attacks and sudden cardiac deaths. And for 4 of those years, the men selling it carried a card in their pockets. They were forbidden to bring up first. In May 1999, the FDA approved a Merck painkiller called Vioxx. It was supposed to be the good version, and for a lot of people it was. For anyone with arthritis who had spent years trading their stomach for their hands, this was an enormous deal. Merck sold it accordingly. In 2003 alone, Vioxx did $2.5 billion. Medicare, by itself, reimbursed more than $1 billion for it while it was on the market. The chairman got that figure from the department's own inspector general, and it is the reason this story eventually lands in front of the Senate Finance Committee rather than a health committee. Finance runs Medicare. It was their money. And in that 1 year, Merck spent $160 million telling you about it directly. Across the drug's life, more than 300 million. You have seen these commercials even if you do not remember them. A woman in her garden, an older man walking a dog at dawn, a grandmother lifting a child, and the famous one, an Olympic figure skater alone on a frozen mountain lake at sunrise, then skating with children, then a bottle held to camera, then the words, "Ask your doctor about Vioxx." We pulled 11 of them. 8 different settings, 8 different casts, shot beautifully, on film. Here is what is not in a single frame of any of them. No side effect, no risk, no warning of any kind. The entire on-screen safety apparatus, across every American Vioxx commercial we could find, is 4 words in small type. Your results may vary. And a line telling you to go read the magazine ad instead. The spoken safety line does exist, and it names one danger: stomach bleeding. The thing the drug was invented to avoid. Hold on to that. Within 2 years, the danger that matters will be a different organ entirely, and the spoken safety line in these commercials will not change a word. In March 2000, Merck finished a study called Vigor. It was a big one. 8,000 patients with rheumatoid arthritis, half on Vioxx, half on an ordinary painkiller called naproxen. And the question was the one the whole drug was built on. Ordinary anti-inflammatories like ibuprofen, naproxen, and aspirin work by blocking 2 enzymes. One of those enzymes is the one protecting your stomach lining. That is why long-term users bleed. Vioxx blocked only the other one. So, does Vioxx wreck fewer stomachs? It did. That result was real and it held up. But the trial measured other things too, and one of them was heart attacks. In the naproxen group, 4. In the Vioxx group, 17. Roughly 4 times as many. Now, there are 2 ways to read that. Reading 1, Vioxx causes heart attacks. Reading 2, naproxen prevents them. Merck published Reading 2. When the trial appeared in the New England Journal of Medicine in November 2000, the finding was framed as a benefit of naproxen, not a hazard of Vioxx. This was called the naproxen hypothesis, and I want to be fair about it because at the time it was not absurd. Aspirin protects the heart. Naproxen is chemically in the neighborhood. It was a testable idea. It was also, conveniently, the only reading of the data in which Merck had nothing to worry about. Here's what nobody reading it knew for another 5 years. 3 more heart attacks in the Vioxx group were left out of the paper. The New England Journal would eventually establish that some of those data were deleted from the manuscript 2 days before it was submitted, and that at least 2 of the authors knew about the 3 additional heart attacks 4.5 months before publication. 3 data points in a trial of 8,000 people. We will come back to what those 3 did to the arithmetic, and it is worse than you would guess. Merck had a problem that was not a science problem. Doctors read journals. Some of them were going to ask. Vioxx stands for the Vioxx GI Outcomes Research Study. Remember that, because a document is about to shout it at you. On April 28, 2000, 1 month after Vioxx finished, Merck sent a bulletin to every field representative selling Vioxx in the United States. It is marked Action Required. It announces a new resource, which it calls the cardiovascular card. That is the card from the beginning of this video. Here's what the bulletin says it is for. The cardiovascular card is an obstacle handling piece and should only be used with physicians in response to their questions regarding the cardiovascular effects of Vioxx. An obstacle handling piece. The heart attacks are not a finding in this document. They are an objection, a thing a doctor might raise, which a salesman must be equipped to handle. And the same bulletin tells the sales force, you may not use the cardiovascular card with your physicians, only if they ask first. A year later, there is another bulletin. May 2001, after the New York Times wrote about the study, and this one is in capital letters. Do not initiate discussions on the results of the Vioxx GI Outcomes Research Study. It comes with obstacle response number 38, which is a script, not talking points, an actual sentence in quotation marks for the representative to say out loud. And a section of that page is redacted to a solid black rectangle. And there is a reason the language of that bulletin sounds like sport. Merck trained for this, and it trained for it as a game. There is a sales training deck, and the deck is called Dodgeball. A representative draws a card with a physician's objection printed on it. I am concerned with the potential edema that occurs with Vioxx. Answering it scores 1 point. Drawing a dodge card and not answering scores 2. I want to be careful here, because this document has been described badly a lot. One of the 12 obstacle cards does mention heart attacks, so we are not going to tell you the subject was hidden. The deck puts it on a card with an answer exactly like every other objection. What it says is that inside this company, not answering a doctor's question was worth twice as much as answering it. That is the game. They printed it, they scored it, and they gave it a name. Now, you might reasonably be thinking, this is a drug company being a drug company, and surely somebody regulates this. Surely there is an agency whose entire job is what a pharmaceutical company is allowed to say about its own product. There is. And on September 17th, 2001, it wrote to Merck's chief executive. Hold on to that date. 2 years later, to the day, Merck sends its sales force one more bulletin, and it says the same thing as the first one. The FDA's letter is not gentle. It tells Raymond Gilmartin that Merck has engaged in a promotional campaign for Vioxx that minimizes the potentially serious cardiovascular findings observed in the Vioxx study, and thus misrepresents the safety profile for Vioxx. It calls the promotional materials false, lacking in fair balance, or otherwise misleading, and then almost nothing happens. The FDA does not pull the drug. It does not fine anybody. It negotiates the label, and the label does not change until April 2002. Senator Chuck Grassley, the Republican chairman of the committee that would eventually haul all of this into public view, later put the gap on the record with dates. From the finished trial to the changed label, 22 months. 2 years after that letter, to the day, in September 2003, Merck issued another obstacle response bulletin about another study. Same instruction. Do not deviate from the language in this obstacle response. Then return to your efficacy messages. Meanwhile, somebody inside that same agency had started counting bodies. What that person found will matter more than every document in this chapter put together. David Graham ran a study with Kaiser Permanente in California, and the scale of it is the point. Over 2 million person-years of patient data. Real prescriptions, real people, real cardiac events, not a trial designed by the manufacturer. His conclusion was that Vioxx raised the risk of serious coronary heart disease, and that naproxen does not protect against it, which kills the naproxen hypothesis. In 2004, his own agency's reaction to this, in his sworn account, was to try to stop him presenting it. He testified that he was pressured to change his conclusions, that a drug safety manager recommended he be barred from presenting his poster, and that the same manager noted Merck needed to know his results. So Merck needed to know. The public did not. The FDA's own witness told that same committee a different version, that what he went through was ordinary scientific review. Both accounts are in the record. He told the committee that in the middle of all this, in August 2004, with his own study sitting on a manager's desk, the FDA approved Vioxx for a new use. Children, juvenile rheumatoid arthritis. He is in the building. His data is in the building. And the approval goes through anyway. And at a meeting that September, a senior manager from his own office had a phrase for his study. Remember that meeting. 8 days after it, the decision stopped being the FDA's at all. It was called a scientific rumor. That was September 22nd, 2004. 8 days later, on September 30th, Merck withdrew Vioxx from the worldwide market voluntarily. Not because the FDA banned it. The FDA has never banned Vioxx. Merck pulled it, and the FDA's acting commissioner publicly said Merck had done the right thing. What triggered it was Merck's own trial. A probe was studying whether Vioxx could prevent colon polyps, and it found roughly double the rate of cardiovascular events in the Vioxx group. Merck stopped the trial and pulled the drug. 7 weeks later, the Senate Finance Committee wanted to know how a drug that an estimated 20 million Americans took, and that Medicare paid $1 billion for, stayed on the market for 4 years after its own manufacturer's trial flagged the signal. And the FDA scientist whose study had just been called a rumor was on the witness list. Remember this number going into that room. 88,000. It is the bottom of the range he called realistic, and it is the only number we will put our name to.
The FDA is currently configured is incapable of protecting America against another Vioxx. We are virtually defenseless. It is important that this committee and the American people understand.
He did not stop there. He told them the FDA and its Drug Evaluation Center were broken, and that the agency's culture viewed the industry it regulates as its client. Then, he did something with the number that I have not seen anyone do since. The conservative estimate, he said, was nearly 28,000 excess heart attacks and sudden cardiac deaths. Then, he said that was not the realistic one. Using Merck's own trial data, the range was 88 to 139,000 Americans, and of those, he estimated, 30 to 40% probably died. And then, he translated it.
Going on, 2 to 4 jumbo jetliners are dropping from the sky every week. There were 2 other revelatory milestones. In mid-August, despite our study,
500 to 900 aircraft. 2 to 4 of them every week, week after week, for 5 years, while the agency responsible was satisfied that nothing was going on. He also attached 2 tables to his written statement that almost nobody has ever read. He had taken 100,000 cases and worked out what that number would be as a share of each senator's home state and home city. Wyoming, 27%. Des Moines, 67%. Lancaster, Pennsylvania, 100%. He was not estimating that everyone in Lancaster had a heart attack. He was showing a room of politicians the size of the number in the only unit they actually feel. But the most precarious thing in that room was something he mentioned almost in passing, and we will come back to it at the very end of this film. And there was one more thing true in that room that almost nobody noticed at the time. The study he was testifying about, the one with the 2 million person years behind it, had already been through peer review at a medical journal. Checked. Accepted. Finished. His own manager still had not cleared it for release. He said so, under oath, in the same statement. He was sitting in front of the United States Senate describing a paper his own department had not yet let out of the building. Nothing obliged them to let it out. If it had stayed in the drawer, the only public account of the largest study anyone had done on this drug would have been the sentences he spoke that morning. One more thing about that hearing, which I enjoy more than I should. The Merck training manual is in the public record because Senator Orrin Hatch put it there, and he put it there to defend the company. His argument was that the committee staff had jumped to conclusions and taken things out of context. He had read the manual himself, and nowhere in it, he said, were salesmen encouraged to dodge a doctor's questions. And then, in the same breath, defending them, he explained the game to the committee. Then, he said, "The rules for the game of dodgeball are clear. Just read the manual." He was right. Read the manual. That is where the 2 points are. Keep the trial itself in mind, though. 13 months after this hearing, a medical journal is going to reopen it and come back to those 3 heart attacks. The journal was the New England Journal of Medicine, and what it did in December 2005 is something journals almost never do. It published an expression of concern about a paper it had printed 5 years earlier, and it printed the arithmetic side by side so you could check it yourself. As published, the Vigor paper showed a relative risk of 4.25, with the 3 events restored, 5.0. That is the whole difference. 3 data points in a trial of 8,000 people moved the number by about 18%, which does not sound like very much, and here is why it was everything. At 4.25, with the trial framed the way Merck framed it, the paper reads as a story about naproxen protecting hearts. At 5.0, the journal's own editors said, it reads as a story about Vioxx damaging them. Same trial, same patients. The 3 data points did not change the size of the finding so much as they changed which drug the finding was about. And now, the honest half, because the journal does not come out of this clean either. The authors published a response. They said the 3 heart attacks happened after a pre-specified cardiovascular cutoff date, which was a different date from the stomach one, and that is a real argument that was made in public and never went away. And the journal's timing was itself questioned. Its executive editor had been deposed in the Vioxx litigation weeks before the expression of concern appeared, and journal emails later suggested the statement's timing was managed. A medical journal waiting 5 years and then moving weeks after its editor was put under oath. Nobody in this story looks good. That is sort of the point, which leaves the only question anybody ever actually asks about a case like this. What did it cost the company? That number will matter, and it is smaller than you are expecting. Now the honest part, because you should not have to take our word for any of this. That approval for children never hurt anybody that the record shows. The drug was gone 6 weeks later. That hearing was not a trial. Senator Hatch objected on the record that members had 8 days' notice, that Merck's documents were under a court protective order so staff could not copy them, and that one of his staffers took 2 hours to get through half of one binder. Grassley said it himself. We are not here to decide whether anybody is guilty, nor is the casualty number a body count. Every figure in this film is heart attacks and sudden cardiac deaths, because that is the thing that was measured. The deaths are an inference Graham drew from them, and he said so. 30 to 40%, probably. Merck's own approved trial, the one that ended the drug, found roughly double the cardiovascular events and no difference in deaths at all. Nor did the courts decide it the way you have probably heard. Merck won 11 of the 16 Vioxx cases that reached a verdict. The famous $253 million award in Texas was cut under state caps and then thrown out entirely on appeal for insufficient evidence that Vioxx caused that death. Merck settled the civil claims in 2007 for $4.85 billion, and the agreement provides that Merck does not admit causation or fault. In 2011, it pleaded guilty to a crime, and this is the part everyone gets wrong. The guilty plea was a misdemeanor for promoting Vioxx for rheumatoid arthritis before that use was approved, a labeling offense. Merck has never been found, civilly or criminally, to have concealed the cardiovascular risk. The total criminal fine was $321 million. At the rate Vioxx was selling in 2003, that is 47 days of sales. And the drug was not finished either. Remember that, because barely 6 months after this hearing, Merck asked for it back. Vioxx was never banned, and it was never quite gone either. In June 2005, barely 6 months after that hearing, Merck wrote to the FDA to ask what it would take to bring Vioxx back to the American market. The FDA answered that December and told them what safety work would be required. Merck never did it. In the government's own summary, Merck ultimately made a business decision not to recommence distribution. The approval itself just sat there. The FDA did not formally withdraw it until September 2022, almost 18 years after the drug came off the shelves. The paper his managers had not cleared came out 11 weeks after the hearing, in The Lancet. It found that Vioxx raised the risk of serious coronary heart disease, and that naproxen does not protect against it. Nobody has successfully argued the opposite since. One more document from 2006. While the lawsuits were running, the plaintiffs suing Merck wanted to depose David Graham. He was the government's own expert on the thing they were suing about. The United States government filed a motion to stop it. Its own lawyers went to federal court to quash the deposition of its own scientist. Judge Eldon Fallon denied the motion and ordered him to sit, which leaves the man who testified. David Graham never left the Food and Drug Administration. Same agency, same work, the same office under the name it was given when they reorganized it. He has co-authored studies out of it for 21 years, since the day he told that committee his agency was virtually defenseless. And as of his most recent paper, he was still publishing from it this month. The scientist testified that the system could not protect you, went back to his desk, and has been working inside it ever since. Nobody fixed the thing he described. They just kept employing the man who described it, and that's the Racket.